They are approved and duly ratified. Time we will now hear previous anonymous public comment from custody. About 5 comments.
Closed captioning is provided for viewer convenience. However, the accuracy of machine-generated captions may vary based on audio quality and speaker cadence. The Board of Correction does not guarantee the accuracy or completeness of the captions. To ensure the safety and protection of individuals using the people in custody comment line, names and inmate numbers have been withheld.
Hello, yes, my name is Brooklyn Casey. My house is Rosen Senior Center. Right now, I'm currently being housed in West Facility in isolation. The issue that I've been having is I am Jewish, I'm kosher, but I also have a tomato allergy. I have called 311 since April 26th of 2025. I have been calling 311. I'm going days without being provided lunch or dinner, and I'm being told that because it comes from a different jail, there is nothing that they can do. I'm currently in isolation, and I have not received dinner because the kosher that they sent over had tomato sauce in it. I am down as having a tomato allergy. The dietitian has emailed them twice as having a tomato allergy. I currently just called 311 before I left Rosen Singer, before I was placed in West Facility, because I didn't receive lunch or dinner because of my tomato allergy. I got here on the 1st. I also didn't receive lunch or dinner here at West Facility due to my tomato allergy. I don't understand because I'm down as having a tomato allergy. Everyone has called. The dietitian has emailed, and I'm still going days without being provided any food, and I'm not able to eat. Right now, I'm on certain medications for the reason why I'm in West Facility, and I'm not going to be able to take my medications because I have nothing to eat, and I'm not going to eat cereal for lunch and cereal for dinner because that's not a meal, that's a breakfast. Please, if someone can help me rectify this problem, I would gladly appreciate it. Thank you.
The caller has hung up.
Hello, my name is Bob Gogan Street. Only because I've been requesting my time calculation because I've been sentenced since September 17th, and they're there at Rikers Island, West Facility. They're giving me the runaround, now telling me the chain of command. They told me it was the social service representative told me I had to ask someone else to keep on circumventing around. I'm supposed to go to the law library or talk to the control booth officer, and I'm just they've just been very inadequate in performing their duties.
The caller has hung up.
Yes, hi, good morning. Because I'm calling from Rikers Island, West Facility. And my concern is about the assault that happened on the 21st of October, and they took at 2 a.m. and they took my tablet, my payroll, and they messed up all my legal paperwork, Okay. They said the reason why they took my tablet was, but then I'm just trying to no paper sign. So if I have confidence or whatever, they're supposed to give me some paper, besides they cannot just tell me, oh, because this or that. No, you gotta paper. So I would like for someone to do something about it, I got it.
Oh, West Facility, yeah, no. restricting me from calling site for no apparent reason. They saying that they don't see why I was restricted. Nobody can reset my passcode. I'm going on 2 weeks now with no commissary for no apparent reason. But then
The caller has hung up.
Good afternoon. My name, my booking case number is I've been housed in building number 5 and also in building number 6 for over a period of 6 months, ingesting black mold. We were removed from building 5 so that they can do some repairs concerning the black mold here at Rosen Senior Center on Rikers Island and building number 5, 6, and 7 ventilation system. That room, the shower area inside of building number 5 was completely covered with black mold. They went in, they did some repairs, and painted over the black mold. No one ever repaired that ventilation system. In the building number 6, I was moved from building number 5. Now I'm housed in building number 6, and the mold is still growing due to the ventilation system. So the shower area in building number 6 is getting worse and worse because no one ever really completely got rid of the black mold in building number 5. So this is something that I've been ingesting again for over 6 months. To this day, I have been put on 2 different inhalers, cough medicine. I have sores inside of my nose. I had to get chest preliminary. I've gotten a chest x-ray. I had my levels tested. It came back completely high at a 22.4, which means I ingested these toxins. Something has to be done. I'm still here in Rosen Senior Center in building number 6, and my health is deteriorating due to this black mold that is not going away. Building number 5, 6, and 7 ventilation system is connected. So if building number 5 has a black mold issue, that means 4 buildings have a black mold issue. These buildings were closed down in the past due to the same problem, and it's not being eradicated. If you have pregnant women that's housed here, there's a lot of women, 40, it's full to the capacity. 45 to 47 women live here, and we're all ingested black mold. It's just affecting some of us different than others. I experienced shortness of breath. I have sores in my nose. Again, I take 2 inhalers, one is a steroid, and take cough medicine. Even with the window open, the ventilation system with the heat, it's causing the black mold to spread rapidly, the heat. Please do something about this. I'm only leaving this testimony to receive some help because of my health issue that I've developed from ingesting.
Hello, I'm calling, and I'd like to leave a comment regarding the serious human rights violations going on here. I just want to state for the record that I was kept in a locked room, in a cell, for over 60 hours, about 2.5 to 3 days, without being let out at all, which my understanding is legally that's cruel and unusual punishment. I've also been kept here hostage as well, denied my religious tray, and all types of other stuff. Have not received any of my medication to the point that I've gotten sick, and it's just caused more further pain and suffering. And it doesn't seem that any of the protocol is followed here regarding the safety and security of the people in this building. My booking case number. My name is. I have reached out to my attorneys, in which I have multiple regarding this, so they're aware. I've made sure to document everything, and I have witnesses as well, luckily, that are either with me or around me, or have documented this stuff as well, and I plan to pursue legal action, because apparently this place doesn't want to change anything, but it just seems extremely dangerous, and none of this seems legal at all. Thank you.
The caller has hung up.
thank you to all who left public comments on our dedicated lines for people in custody. To the board, page 11, in your board book, you will see some of the actions taken by department or Board of Correction staff members to address the comments made by persons in custody. So that would be the page 11 in your board book under section 4. So redacted comments have been shared with the department. All comments associated with a facility have been assigned to a VOC facility monitor and have either been resolved or being addressed. So at this time, I'd like to turn it over to Jasmine for Executive Director updates.
Thank you, Chair. Good afternoon, everyone. Happy New Year. I'll begin with a brief overview of the board's mandate, followed by updates on key trends observed in 2025, including overcrowding in the Special Management Unit, our priorities for 2026, an update on deaths in custody since our last public meeting in November, and finally, observations from board staff regarding the Department of Corrections Clinic Production Dashboard Pilot. The New York City Board of Correction is an independent oversight body established by the city charter. The board's core responsibility is to establish, monitor, and enforce the minimum standards governing conditions of confinement and correctional health services in all city correctional facilities. We fulfill this mandate through facility tours, data and document review, investigation of complaints, public reporting, and regular engagement with the Department of Correction and Correctional Health Services, elected officials, and the public. Our mission is to promote safe, humane, and lawful conditions for people in custody while advancing accountability and transparency within the city's jail system. Throughout 2025, the board continued to observe sustained overcrowding across the jail system. Population levels frequently exceeded operational capacity, compounding longstanding challenges related to staffing shortages, delayed movement, access to services, and compliance with minimum standards. In 2025, the daily jail population rose sharply mid-year before partially declining toward year-end. The population increased from 6,507 on January 1st, 2025, to a peak of 7,723 on July 22nd, then fell to 6,782 by December 31st. The mid-year increase coincided with a significant rise in the number of sentenced individuals awaiting transfer to state prison, which grew from 61 at the start of the year to a high of 899 in early July, before declining to 174 by December 31st. In response to overcrowding, the department requested multiple variances from the board's overcrowding minimum standards between November 2024 and July 2025 to increase bed capacity at EMTC, OVCC, and the West Facility Annex. In April 2025, the department also expanded the number of men housed in the 800-bed building at the Rose M. Singer Center as an additional measure to address overcrowding. In July, the board did not grant the department's variance request, reinforcing the importance of compliance with the board's minimum standards. Between July and November, the jail population decreased by approximately 8.35%. While overcrowding eased at OVCC and the West Facility Annex, dorms at EMTC continued to exceed the 50-bed limit for several months. By December, overcrowding in those dorms had declined, and as of December 30th, no dormitories at the new admissions facility were operating above bed capacity. The board will continue to closely monitor population levels and facility conditions to ensure ongoing compliance with the board's overcrowding minimum standards. In 2025, the board also raised serious concerns regarding the department's establishment of a Special Management Unit, or SMU, without prior notice to the board and without clear demonstration of compliance with minimum standards governing restrictive housing. The SMU opened on February 6, 2025 at OBCC. The unit operates on a 7-hour daily lockout schedule. From February through November 2025, there were 198 placements and approximately 16 appeals. As of December 31st, 2025, 30 individuals remained housed in the unit. Shortly after the unit opened, the board identified several violations of the minimum standards requiring corrective action. In March 2025, the board issued a notice of violation letter to the commissioners citing deficiencies related to due process and security classification, access to congregate religious services, specifically Muslim Juma services, and access to law library services. In response, the department implemented procedures to ensure access to religious services and law library resources and clarified housing placement protocols, hearing requirements, and appeal mechanisms. While the board does not support the SMU and continues to maintain that the unit should be closed, the board will continue to monitor and publicly report on conditions within the unit. Individuals housed in the SMU are still required to be placed in restraints when escorted throughout the facility, including for medical and other services. Additionally, given the increased number of lockdowns at OBCC, out of cell time for both the SMU population and the broader jail population remains an ongoing concern. Oversight of restrictive confinement remains a critical focus for the board, given the well-documented risk associated with isolation and limited out-of-cell time, particularly for individuals with mental health needs. The board will continue to raise these issues with facility and department leadership and will update the public on any significant changes affecting compliance with the minimum standards. In 2026, the board's priorities include strengthening compliance with minimum standards, particularly in areas related to restrictive housing, sick call, recreation, visits, and documentation. Continued oversight of the borough-based jail transition and the city's compliance with its legal obligations to close Rikers Island. Ongoing review of deaths in custody with a focus on prevention, timely reporting, and implementation of board recommendations, and ensuring meaningful public engagement and transparency through public meetings, reporting, and responsiveness to stakeholder concerns. Next, we share our deepest condolences with the families and loved ones of department staff who have passed since the board's November meeting. The staff who have passed are civilian city laborer assigned to the Facility Maintenance Repair Division, Thomas Edward Farley, retired officer Paul Piskovich Sr., retired officer Alpha Omega Joseph, retired Captain John Francis McCarthy, retired officer Louis Thomas Wright, retired officer Michael Gonzalez, retired officer Jose Naranjo, retired Captain John McLaughlin, retired Captain Rosemary Butler, retired officer Darrell G. Hunter, retired Captain Phyllis Lewis Miles, and retired officer Edward Malone. There were 3 deaths in custody between November and December 2025. We extend our deepest condolences to the families and loved ones of Edwin Ramos, Aramis First, and Kyron Randall. Edwin Ramos, age 38, died on November 21st, 2025. Mr. Ramos collapsed in the bathroom of his assigned housing area in OBCC, prompting a medical emergency. He was transported to Mount Sinai Queens Hospital, where he was declared deceased. Aramis First died on December 7th, 2025, at the age of 32. Mr. First was transported from OBCC to Mount Sinai Queens Hospital after he was found unresponsive in his cell. He was pronounced deceased at the hospital. Kyron Randall, age 33, died on December 22, 2025. Mr. Randall became unwell in his assigned cell in GRVC's PACE unit. He was transported to Elmhurst Hospital, where he was subsequently declared deceased. We're in the very final stages of a review of the second report and recommendations on 2025 deaths in custody, covering the deaths of Benjamin Kelly, James Maldonado, Christian Collado, Edwin Quispy, Ardit Billa, Jimmy Avila, and Carlos Cruz. It is imperative for the board that these reports are accurate and portray the full picture of the circumstances leading up to each death, requiring careful review of materials and conversations with DOC and CHS to gather additional information. We thank you for your patience as we finalize the report, which we expect to issue within the next week. The final public report on the deaths of Edwin Ramos, Aramis First, and Kyron Randall will be issued shortly thereafter. Regarding census data, as of January 12, 2026, there were approximately 6,865 individuals in department custody, and broken down by facility as of January 12th, in the Bellevue Hospital Prison Ward, 69 individuals, Elmhurst Hospital Prison Ward, 13, EMTC, 1,346, GRVC, 881, NIC, 299, OBCC, 1,421, RESH ESH, 137, RESH non-ESH, 487, RMSC, 456, RNDC, 1,068, and in West Facility, 686. Finally, I'll briefly summarize board staff observations related to the department's clinic production dashboard pilot. Board staff observed that the clinic production dashboard pilot at the North Infirmary Command operates in a relatively controlled environment with limited movement and lower sick call volume, in part because many housing areas provide medical care on unit. Staff noted that in larger facilities where sick call demand is higher, on-unit care is limited and movement is more complex. Reliance on fragmented documentation could result in greater gaps in tracking and oversight. The dashboard has the potential to provide the department with an independent record-keeping tool to track sick call requests, clinic arrivals, and care provided consistent with the board's minimum standards. However, significant gaps remain. Incarcerated individuals continue to rely heavily on the CHS triage line to request sick call, resulting in fragmented data between CHS generated lists and DOC documentation. This fragmentation limits the department's ability to maintain complete, accurate records and effectively monitor whether sick call requests result in timely care. Staffing and provider availability also continue to affect how care is prioritized and delivered. The board looks forward to hearing an update from the department on the dashboard pilot during today's meeting. The board will continue to monitor this pilot closely and evaluate whether it meaningfully advances compliance with the sick call minimum standards. That concludes my update. Thank you.
Thank you, Executive Director Jasmine. I'd like to just comment one section of your update where you talk about continued oversight of the borough-based jail. I would just like to maybe respectfully amend that to continued and increased oversight of borough-based jail transition. And I see that at reviewing the great work done at the Bellevue Hospital site, that with some input from DOC staff, the transition can be, more seamless. I'll turn it over to CHS for a presentation of their variance request, followed by public comment on the variance request and a board vote. These are the various requests for psychotropic medication and tuberculosis screening process.
Good afternoon. My name is Joseph Otanakar. I'm the Chief of Mental Health Service.
Zach Rosner, Chief of Medicine.
Today we are again requesting a 6-month variance from the board standards concerning psychotropic medication. The requested variance, first granted in 2005, authorizes psychiatrists to see and evaluate stable patients on psychotropic medication in the general population every 8 days rather than every 14. As the board has acknowledged in the past, this variance helps to improve patient care and is more consistent with community standards.
The second, excuse me, the second variance request relates to tuberculosis screening in the jails. It expands the options for tuberculosis screening tests from the board standard, which includes tuberculin skin testing, to also include a blood test, which is consistent with the standards of care in the community. If you're on blood test is a one-time blood draw, doesn't require follow-up in hours as the skin test usually does, and it's generally the standard of care in the community. So we requested this variance in the past to allow this use of the screening test. And
Thank you. I just wanted to make a note that the board has a scheduled hearing on these particular minimum standards to make permanent amendments to the minimum standards in basically to align with what you're asking for in your variance request. And I just wanted to note for the board members that hearing is scheduled for February. And so the variance request is necessary today because the hearing is scheduled for February and it's expiring.
Do any board members have questions for CHS regarding continuing variance? And now we will hear public comment on CHS variance requests. Each speaker is limited to 3 minutes. Do we have a speaker list?
Nobody has signed up outside. If anybody present in the room wants to speak, please do come to the podium. And if anybody online wants to speak, please raise your hand in the chat.
Okay, hearing none. Will a board member move to a vote?
So move.
Is there a second?
second.
At this time, we'll open discussion for debate. I don't think there is, any real debate on this because we're looking to rule change standards. So there's no conditions to the variances. I think that some procedural stuff I have to ask, and so bear with me, board members. So any board member proposes a condition? Yes, go ahead. Skip.
I just wanted to ask, once we have this rulemaking session next month, how long will it take for you to fully implement the changes into the new regimen, and that's for both variances. Because I see one of these variances has been ongoing since 2005, and that is entirely too long.
But because we've been granted those variances, they're already active and implemented.
So
we,
there's no changes, no policy procedures, nothing like that?
Nope.
It'll just be the new way from now on,
Yep.
period?
Yep.
Okay, so first I'll ask for a motion to approve first variance.
So moved.
And then by roll call vote, I ask each board member to state out loud if they are in favor or against. So Board Member Jude,
I vote yes for both.
Vote yes for both.
Felipe,
Yes for both.
thank you. Dr. Stasso,
Yes, for both.
Judge Cosier,
Yes for both.
Vice Chair Skipper,
Yes, for both.
and I'll vote yes for both. And the vote for first variance is approved, 6 months variance. Now I'll take a motion for the second variance request, tuberculosis. A motion for variance.
Moved.
Yes, second.
Second.
And by roll call vote, start with you, Vice Chair Skipper,
Yes.
Judge Cosier.
Yes.
Dr. Stasso,
Yes.
Board Member Felipe,
Yes.
and Board Member Jude.
Yes.
And I say yes. And the vote passes and approved for the variance. So thank you. We will now hear from Tanya Kropek, Chaplain Dr. Victoria A. Phillips, Ashley Conrad, and Michael Klinger regarding the successes and challenges of the Rikers Island Working Group was active between 2015 and 2020.
Peace and blessings, everyone. Good morning. Good afternoon.
Afternoon.
Happy 2026. Thank you so much for this opportunity to speak to you a little bit about what I'm super excited to say the Jails Action Coalition assisted in getting going many, many years ago. So I'm Chaplain Dr. Victoria A. Phillips, and these are my comrades. I'll just start us off. So, sorry, my brain picks up noise. So in 2011, the Jails Action Coalition formed. We were never funded. We were a coalition of dedicated volunteers, and we formed because of conditions on Rikers Island and our community members. And we knew that if we didn't take care of ourselves, no one would take care of us. And so we are a coalition still thriving today of directly impacted, formerly incarcerated, the loved ones, service providers, legal professionals, many, many people, clergy members. The community is who we are. And I say that because we quickly found out that the incarcerated, we fought for many things: testimony, visiting rights, names of the deceased to be played at the meetings, ending of solitary for 16, 21-year-olds, so many different things. But one key thing kept coming back when we would meet people at the bus stop, when we would meet people on the island, when we would talk to people in the community, and that is visiting. And so we understand how important visiting is, and visiting is a lifeline. You all know, upon joining the Board of Corrections, that the Jails Action Coalition has reached out to all of you. We do that with anyone in position of power to make change or preserve life for those on Rikers Island in any DOC facility. I say that because one of the people that we reached out to years ago, I'm moving along, one of the people that we reached out years ago was Commissioner Pont. We reached out to all the commissioners, every administration we want to be connected to, because we are the people. And so Commissioner Pont had came around many moons ago, and he met with us. And upon meeting with us, he heard truth. He heard expertise through lived experience. He heard ideas that he wanted to follow up on. And I'll allow my other colleagues to tell you about that. But I just want to say before I walk away how important it is that we understand that visiting also has to have a level of accountability. Visiting has saved lives that were being denied access to medical. Visiting has saved lives when someone was maybe physically harmed. Visiting has saved lives on the spiritual aspect. And we also know that visiting is one of the key components to one's reentry, their safe reentry, by keeping connected with those they love, family. And when we say family, I just want to highlight that does not always mean blood. That does not always mean blood. It means those who care for you and will look out for you. And so Jack has lent his hand and expertise to the community, to elected officials, and to the Board of Corrections throughout the past decade. I don't think there's anyone that will speak to you today that should not be a part of the vision moving forward with visiting, because they all will speak from a level of expertise, a level of history, so that those who are doing the work today will know not how to stay as a hamster on the wheel. Because each administration change comes with bright ideas and a vision, but often we become stagnant as a society and those doing the work when we don't push ourselves forward. So listen today, listen to Tanya, listen to Michael, listen to Liz, listen to Ashley, and hear them and understand why they should be a part of Visiting Group 2.0. Peace and blessings.
Thank you. Thank you. Good afternoon. My name is Liz Mayers. I'm a member of the Jails Action Coalition. I'll speak briefly about how a visit work group got started. I began visiting a young man in custody at Rikers in 2013. Like every other visitor, I faced tremendous obstacles and was upset about how difficult it was to make a visit to a person in custody. Sometime after Joseph Pont became Commissioner of the Department of Corrections in 2014, we invited the Commissioner to attend a meeting of the Jails Action Coalition. We knew that he recognized the vital importance of visits to people in custody, and we spoke of the significant problems that visitors face when visiting someone at Rikers. We suggested establishing a committee of individuals from concerned organizations to work with the department staff to focus on these problems and offer ideas which might ameliorate visiting conditions. Commissioner Pont supported the establishment of such a group located in the office of the Commissioner and assigned a member of his executive staff to attend our meetings with an assistant to work closely with us. Uniformed staff members also attended. Individuals from the Osborne Association, Brooklyn Defenders Services, the Fortune Society, and the Jails Action Coalition comprised the early work group. As our first effort, we urged the hiring of greeters to help arrivals as they got off the Q100 city buses at the Perry Building. We developed new signage that was actually helpful For example, informing visitors that being fingerprinted is optional. We pushed corrections to establish the Rikers bus service to replace the lengthy and complicated necessity of using public transportation. We worked on making it easier for families with children to enter the jails and tried, but did not succeed in those early days, to reduce the number of checkpoints. We strongly urged establishing trainings to visit staff. Tanya Krupat, a member of the group, wrote the first curriculum. I left the group in 2018. Subsequently, much was accomplished before the group ended in 2020. For the sake of those in custody and families who visit them, I believe it is absolutely essential to reintroduce such a collaborative working group in the department. Thank you.
Thank you for including visiting on the agenda. Thank you, Dr. V and Liz, and for giving us this opportunity. My name is Tanya Krupat. I'm currently the Vice President of Policy and Advocacy at the Osborne Association. To add what Dr. V and Liz have shared, I was also part of the visit work group from its inception and was so excited that the Jails Action Coalition created this and that the department responded, taking it very seriously. As you've heard, we met for many years and only disbanded because of COVID and a change in administration when this was no longer a priority. We continued to meet during COVID and to push the department to reopen in-person visits once safe to do so. Despite our efforts, visits were suspended entirely for 15 months. Visiting still bears the scars of COVID, including one less in-person visiting day each week. There are no longer in-person visits on Fridays. So it's important to know the history of all that we worked on and what the work group was able to accomplish, some of which is still visible. As Liz shared, we created the visit greeters and the DOC visiting van, significant updates to the website, and other improvements which are no longer visible, like improving signage, handbooks, repairing non-contact visit booths, and repairing broken lockers. As a work group, we met in person, usually at the Bulova building, but we pushed to meet on Rikers so that we could be joined by visiting officers and visiting captains, the people on the ground. We wanted to be as hands-on as possible, and it was really important that the work group included people who were actively visiting someone on Rikers. It was also important that we had a representative from the BOC and that the DOC point people were located within the Office of the Commissioner and had the authority to act. We also worked very closely with the captain of the Central Visit House, where all visitors are processed. The community partners played a key role. We helped identify solutions, track progress, do research, bring in examples, models, and tools. We helped keep things moving, and we shared what visitors were experiencing and what they needed. As Liz mentioned, we tried to move to one security checkpoint, not the two that currently exist. And when we started, Commissioner Pont shared that he'd never seen a jail system with 2 security checkpoints for every visitor, and he wanted to look into why this was needed. We wanted to address culture, to create a culture that supported visiting. This included training, but not a one-time class, an ongoing focus on supporting the visiting experience and maximizing the benefits of visiting for everyone. I want to now share a statement from former BOC Commissioner Stanley Richards, currently CEO of the Fortune Society and a member of the original DOC Visit Working Group, who can't be here today. Stanley shared, I applaud the Department of Corrections' recent announcement to invest in improving the visitor experience at Rikers, including hiring the first ever Executive Director of Visit Operations. In my time as BOC Vice Chair and then as First Deputy Commissioner at DOC, I focused on this issue because I know from personal and professional experience just how important it is for people to stay connected to their loved ones while detained and incarcerated. I represented this board on the DOC Visit Work Group from its inception until I stepped down from the board. The work group accomplished a great deal due to its diverse membership of critical stakeholders, including community members and providers. One of our most notable accomplishments was the implementation of expedited visiting times for visitors with young children. I'm extremely proud of that work, and I hope it will continue. In addition, I also advocated for visiting to be a standing agenda item at BOC monthly meetings. I urge the current board members to reinstate this focus on visiting, given its significance to our fellow New Yorkers who are detained on Rikers and families and community members who visit them. I also urge DOC to reconvene the visiting working group. The Fortune Society stands ready to participate and to support these efforts. Now I'm back to being Tanya. I will close with this thought. What if we had a jail system centered around connection, around making sure people maintain connections to their families and loved ones and to a positive support system? And if they didn't have these connections, what if the system helped to build them? What if we knew who wasn't receiving visits and staff met with them to see who in their life they might want to visit them, or to build new connections so they left connected to a positive support system? What if we worried about people who weren't getting visits and we made sure they got them? Given that the majority of people detained on Rikers have either a mental health diagnosis, seek mental health services, or have a trauma history, and certainly everyone there needs mental health support while surviving the traumatic experience of being on Rikers, this is all the more important. What if the whole system was recalibrated around the fact that we know that isolation is harmful and bad for people? This includes solitary confinement, and it includes removing barriers to visiting and promoting healthy relationships for all those in DOC custody and for all the children and families connected to them. This is the moment to make this shift. Thank you.
Good afternoon, board members. My name is Ashley Santiago Conrad, and I just want to tell you today the experience of visiting a loved one on Rikers Island and why it's so important to reconvene the working group on visitation. So my nephew, who was diagnosed with developmental disabilities, autism, and disruptive mood dysregulation disorder, sat on Rikers Island for about 2.5 years in dire need of mental health. And during that time, my family and I made it as much of a priority to see him as often as we could. Saturday visitation process looked like this. It consisted of arriving at around 7 a.m. to wait under that honest hell of a bus shelter to take us over the bridge. And as soon as you're over the bridge, the day starts out with loads of rules. Waiting outdoors while papers are also being thrown at you to fill out while you're also trying to take off your shoes, prep for going through metal detectors, putting your stuff into lockers that are outside, having your fingerprints scanned and traced for drugs. Let me not forget that visitation protocol was also always on visitors like us to look up on our own. Traveling to Rikers with my sister and 2 very young nieces always made me the most frustrated. I would watch guards yell at my 3-year-old niece to hurry up, to not touch the dogs. What did I say? Stand still, face the wall. I said face the wall, even forcing my 3-year-old niece to shake out her diaper. Finally, when you do get to the jail, or when we got to the jail where my nephew was, that didn't mean we went straight into a visit. Sometimes we'd just be sitting in NYC or GRVC anywhere from 3 to 5 hours in cramped, airless waiting rooms just to see him. I watched my diabetic sister hold out as long as she could in hopes to see my nephew without her insulin or her pump. I've also seen mothers with their newborn babies who would have to leave before even getting to their visit because their child needs to eat every couple of hours and no formula nor baby food is allowed. No one's time is taken seriously until that 1-hour visitation is over. Then you can hear the yell of guards. That's it, visitation is over. Hurry up if you want to catch the bus because the next one we won't be back for another 30 minutes. That's right, another bus just to escort you sometimes literally across the street. On Sundays, we'd go through this ordeal without even seeing my nephew at all. Many times, Department of Corrections would tell us that my nephew didn't want to come down, even when he knew we were coming and was waiting and looking forward to our visit. We left upset, crushed, and when he would call us later upset, that he would let us know that the Department of Correction actually never came to get him. Or on many days, we travel all the way to the island just to be told at the entrance, if anyone is here, for example, for OBCC, please turn back around. The building is on lockdown and nobody will be getting any visitation. Information that would have been helpful to have before making the long trip there. Although there is no replacement for seeing your loved one in person, you might think that video calls could help family members stay connected when they don't have the time or energy to deal with the ordeal of visiting Rikers in person. But no, setting up televisits involve making multiple requests, then waiting for confirmation that could be denied or approved down to the very minute of the scheduled time. Even then, confirmation didn't hold any value. We still have to wait for guards to bring my nephew down, which often ate up huge chunks of our 1-hour visit slot. Or sometimes, again, they never brought him down at all. Altogether, we would just stare at a computer screen waiting for my nephew to come down and never notified why or what went wrong and why he never showed up. Sadly, we continue to hear, or I continue to hear the same traumatic experiences from my members as a senior community organizer at Freedom Agenda on constant basis. One of our members even shared that every time she visited, she was told that her hands tested positive for drugs. She had never taken or touched drugs, and she was prevented from having contact visits with her son. And then later, a DOI report revealed that the Department of Corrections drug testing produced false positives around 85% of the time. As my comrades mentioned, especially in the limelight of the last 3 deaths and the deaths that we've seen from 2021, visitations are so important, not only for incarcerated individuals, but for loved ones who unfortunately may not even get the opportunity of seeing their loved one again because of the conditions of Rikers Island. And so with that, I think it is so important to reconvene this working group. Thank you.
Good afternoon. My name is Michael Klinger. I'm a jail services attorney with Brooklyn Defenders. Thank you to the board for the opportunity to reflect on the past work of this collaborative group and to share a few thoughts about its potential future for success, just to piggyback on the excellent comments from my colleagues. As I listened to my colleagues describe the group's earlier efforts, which predate me in my role, I was struck by a point made by Tanya from Osborne Association, one that holds promise not only for improving visit experience at the jails, but for life on Rikers Island much more broadly, whether you live there, work there, or are visiting a loved one there. Tanya recalled the 10 full-day off-site trainings that this group organized in 2019 for public-facing department staff. I think I expected to hear about the challenges involved in putting that together, like logistical hurdles of scheduling 10 all-day trainings at John Jay, or finding a skilled facilitator, or securing the department's buy-in, or raising the money that it might take to fund that program, but that's not what I heard. Instead, I heard 2 things. First, an inspiring account of the program's successes, and second, a sobering acknowledgement of its failure. I don't want to dwell on that failure, the lack of follow-through after the trainings when we collectively failed to build on the momentum created in those rooms. It was a missed opportunity and we must do better. I want to focus on the successes. Each of those 8-hour days began the same way. A group of department staff arrived in an unfamiliar room, far from the jails, facing a long day's mandatory training, told that the topic was improving their empathy. I'm sure we can all imagine the level of skepticism in that room. But the day built on an acknowledgement of those staff members' own lives, their schedules that pull them away from their own families on weekends, on holidays, birthdays and anniversaries, pulling double and sometimes triple shifts, with long commutes and the daily stress of a chaotic workplace. There's no question that we ask a great deal of the department staff. Only by recognizing their sacrifices could the group then ask for something more, that officers pause to remember that a child visiting their parent in the jails, maybe for a 6th or 7th birthday or for Mother's Day, or indeed a parent visiting their child, is experiencing a moment that they have anticipated for weeks or maybe months, a moment that matters deeply to both the child and the parent. It is true that department staff are paid and they go home at the end of their shifts. Their experience is not the same as those of the people in custody or of their families. But what emerged in these workshops was powerful. The simple act of listening, of acknowledging staff members' own stories and challenges, transformed the room. Skepticism gave way to understanding, and by the end of the day, maybe even warmth. Now, I'm not sure that everyone in those rooms was convinced, but as my colleagues have described it to me, each training ended the way meaningful conferences and retreats always do. People exchanging contact information, asking to stay in touch, and urging that this work continue. We can get back to that moment. And more than that, we believe that as a proof of concept, the culture of the Department of Advocacy itself is neither fixed nor immutable. So our requests today, to parrot some of what you've already heard, are straightforward. First, in addition to the department's welcome decision to create an executive position overseeing all visits to all of its facilities, we ask that the department revive and recommit to this collaborative working group, including by designating a consistent group of uniform and non-uniform staff to participate. Second, we ask that this effort be situated in the office of the commissioner, with the commissioner or a designee serving as a permanent participant, as was done previously. And finally, we ask that this board request or require regular updates from the work group delivered by a designee of that group at every board meeting. Visits by loved ones are a critically important part of this department's work, but what we are describing has the potential to do even more than improve visits. Through this and similar collaborative efforts, we believe it is possible to recenter the humanity of all New Yorkers who live, work, or visit Rikers Island. My colleagues and I would be happy to answer any questions. Thank you.
Vice Chair Skip.
Yes, I want to thank you for that. As an academic and as also the only sitting member of this board who has lived on Rikers Island for an extensive amount of time, I cannot begin to expound upon the need for human beings to create community. We are social creatures. We crave community. We crave to create community. We crave to be in communities. These communities are intersectional. They intertwine, they interweave, they are braided together. But that visit process is an integral part. I applaud your efforts from before. I applaud you standing here before us asking to reinstate. I am throwing myself on this. I am willing to be the board liaison or however we decide to do this, Chair. You know, and I think this is a vital, vital part of a reform that needs to institute as we look at how we are treating the people in custody who could be members of our family, our brothers, our sisters, our mothers, relatives. We're all connected for all New York City. You know, whether we live on Rikers Island, whether we work on Rikers Island, we're still connected. So thank you for that.
Board Member Felipe.
Yeah, hi. I have a couple of questions regarding background and history. This is super exciting, and interestingly, I just saw the commissioner and Torres and said, like, you think this opportunity of doing more collaborative work moving forward. One of the things that I do remember when this came up, it was beyond just visiting. I mean, it was about engagement. And I do remember Commissioner Pond looking into utilizing a national set of standards called performance-based standards with the idea that, I mean, they're used actually at ACS, or they were used at ACS, I think. I don't know if anymore. But the idea that actually families, young people, and actually officers or, you know, staff could twice a year kind of give feedback in terms of how the culture and environment was. I know Commissioner Pond looked into it. I think even did a cost analysis, and they were thinking of doing it for the emergent adult units only at the beginning. Nothing ever happened, but I think this is an opportunity to go beyond just visiting. And again, I you know, you guys know it better than anyone. That's what makes it different. I mean, we could get academic, we could bring Bruce Western here to talk about the power of connections and networks as a predictor of public safety, but this is the right work, and as my other members said, I mean, I'm fully behind as an individual behind this. The other piece is, were there other agencies involved in the work group? Like I'm thinking about ACS, HRA, were they?
We did consider, We did consistently invite ACS, and I don't want to folks, but they have the CHIP visiting program and also have children in foster care who have a mandate by regulation to be visiting their parents. So I would, and that they.
And I think to keep on are known, ACS. Thank you. I mean, I couldn't think.
I would just add to that, I don't know what coordinating across agencies, whether and the work group to be a huge body, but in DYCD and homeless shelters and education in our schools, at doctor's appointments, are children and families affected by trauma of having a loved one on Rikers? Are people who spend time on Rikers? And all the positive aspects of broadly about the ripple effect.
Well, I can say that learning, appreciate that. I encourage board members to tour, get visits. I get visits Thanksgiving Eve, Thanksgiving Day. Travel critical areas with family, and to, you know, to speak to the family that going through the process and to understand some of the high points, some of the praise they give the department, and some of the get very specific. Facility, staff tours. So I encourage you sometime. I really like to hear from the department, have set this as a priority. Shouldn't be. I'd like to not sort of too much their leadership in that formulate, come back, but visits are very important. I mean, I spent deputy at half a day, given day, and I didn't have any staff with me, just me to speak with family members, stand at 9 p.m. sometimes, get your bus schedules. So it is real. And I really appreciate it. I apologize with my voice. I got off a 15-and-a-half-hour flight at 5:30. Just a little tired. That's no other questions. Thank you. Okay, I'm asked to speak louder, but my energy is down, so I'll try to speak louder. We will now have DOC updates. We'll now hear updates from the department briefing on clinic production dashboard pilot at NIC in compliance with sick call minimum standards.
Good afternoon, members of the board. My name is Kathleen Zadzora, and I serve as the Assistant Commissioner for Health Affairs. Today, I will provide an update on the department's clinic production dashboard pilot and compliance with sick call minimum standards. The department remains firmly committed to ensuring that persons in custody have timely and reliable access to healthcare services. At present, clinic production, including sick call requests, continues to be managed pursuant to the department's established policies and procedures. Persons in custody who require more urgent same-day care may speak to a nurse via the health triage line or to a housing area officer and request to be seen in the clinic. For those requests made directly to officers, that request is communicated to the clinic officer, and the clinic officer coordinates with the charge nurse or other clinic supervisor regarding the individuals who need to be seen. These walk-in clinic encounters are considered unscheduled call downs. As the board is aware, the department is advancing its efforts to modernize operations through the implementation of an electronic clinic production dashboard, which was a commitment we made last year. In November, the department soft launched the dashboard at the North Infirmary Command, and a teletype was also issued announcing this launch. During the pilot, the department has focused on testing and monitoring system functionality and operational workflow, developing communications about the pilot, and gathering feedback to inform refinements during this intentional pilot phase of implementation. Communications at NIC related to the pilot have been directed to both persons in custody and staff. For persons in custody, outreach has included tablet announcements, engagement through the PIC Council, and posting of informational posters in all housing areas. To be clear, the opportunity for people in custody to request sick call from an officer is not new. It's the ability to track it, which we support. For staff, in addition to the training that they received, the department has also developed a reference guide and FAQ sheets, which were distributed during roll call and hand-delivered to clinic and housing area staff. Poster versions of these materials were also placed in the clinic and staff common areas. It's important that we recognize this is a significant shift in how our staff perform daily operations, and we want to ensure that they have the resources and support to do this successfully. Clinic staff have responded positively to the pilot and have provided helpful feedback on potential enhancements to further streamline operations and improve efficiency. Housing area officers have also demonstrated a clear understanding of how to operate the dashboard and have reported little to no difficulty accessing the system. At the same time, the department recognizes that this pilot remains a learning process and is taking a careful, iterative approach. Our partnership, collaboration, and communication with correctional health services, leadership, and facility staff has been productive in this new endeavor. Full data integration from CHS remains an ongoing matter for both agencies, and we're actively working to resolve any issues. DOC provides CHS with regular updates, and our respective IT teams meet weekly in order to address and continue improving the system. For next steps, the department will continue to incorporate staff feedback, monitor functionality and connectivity, and refine the system prior to expansion. We anticipate expanding the dashboard to an additional facility in the spring. We appreciate the board's continued support and partnership, and we look forward to providing additional updates as this work progresses. Thank you, and I welcome any questions.
Any board members have questions?
Yes, I'd like to know what facility will be next for this, or is this just a pilot to be analyzed and then rolled out in the near future?
Thank you for the question. We're exploring and have narrowed down, but we're not ready to state which facility next.
Can you at least tell us which facility is in the running, or you're looking at, or are you looking at all facilities?
So we're looking at some of the larger facilities, as the executive director highlighted in her update. NIC is a little unique given its clinical footprint and its size, so a larger facility.
Okay, thank
you. Okay. Yes, go ahead.
Thank you. In regards to DOC analytics and statistics, what's the frequency in terms of the data is collected? The daily, weekly, monthly?
So the data that are going into the dashboard, it's happening several times a day.
And would that be available in terms of the reports? Would that be available to board staff?
So we're not currently generating reports in a way that I think that you're asking about, but it's certainly something that we can explore. Yeah.
Any other questions on that topic area? Yes, go ahead, Dr. Stossel.
Thank you.
So I'm having a little bit of trouble with the terminology, I guess, because it seems to me that what's being tracked as sick call in here are the scheduled CHS visits that have already come in through the triage line and been added to a call down list. I think what has been sort of concerning to us in an ongoing way are what you're calling here unscheduled call downs. But I think to me that's sick call. Like those are the visits that I think when we're thinking about minimum standards and we're thinking about wanting to make sure that folks in the housing areas understand that if they can't get through to the CHS triage line, if they don't know when their next scheduled visit is and they have something urgent, that it is, as you said, it's always been possible for them to speak to a housing area officer, but we want to make sure that people really understand that that is a way that they can actually get down and get seen, that, that request made to a housing area is definitely going to get added into a system and result in production to the clinic. So I'm curious about whether there's a plan to sort of zero in on that category of visits, and then separately, whether there is some point of comparison to make sure that whatever is getting logged as a request for, whatever you end up calling it, a sick call visit, an unscheduled call down visit, to make sure that the number of requests getting logged into the database are representative of the number of individuals actually asking to get seen in the housing area.
Sure. So thank you, Dr. Stossel. I think there's two aspects to what I'm hearing you say, and so then I may ask you to remember everything that you said. So there's the operational piece, which is in the dashboard as far as what is being tracked. And so to be clear, the dashboard encompasses scheduled call downs requested by CHS, and that's for a variety of services. It also includes what we are terming unscheduled call downs, unscheduled walk-ins, and that's a little bit more of what's happening in a moment. So that might be a 311 call that comes in and processed through the facility, an individual was brought down to the clinic, but they weren't on a scheduled list. CHS was not anticipating seeing them. At present, that's documented in the Clinic A book, but it's not something that we're able to track systematically. So CHS obviously knows this individual has been presented to them for an unknown reason that they weren't anticipating, but on our side, we don't have that, we didn't have that piece. Now we do. Now we're able to say that. And then additionally, you have individuals requesting sick call, which, to be clear, is not what's coming through the health triage line, because that's turning into a scheduled encounter. So again, we may say that's sick call, we may not say that's sick call. Per the standard, we've been made to understand that that's not what we're talking about here. So instead, that's requests made to staff that maybe in that exact moment they can't be brought down, but there's an expectation within the confines of the standard that they will be brought down. And so we're able to document that by the officer on the A post entering that individual's information, and then that appearing in the dashboard as a sick call request.
Right, but so are you saying that a request made by an individual in custody to see medical that is not already scheduled, that is not what the minimum standards mean when they say sick call? I think that is what they mean.
No, I think that is what it means.
Okay, but but in your database, it's not being called sick call. It's being called an unscheduled
No, it is.
visit.
I'm sorry. It is being called sick call.
Okay.
If an individual goes up to an officer and says, I don't feel well, I'd like to be seen in the clinic, when that's entered by the A officer, that's showing up in the dashboard as a sick call request.
Okay. And then it's only being called an unscheduled visit on the back end when they're actually seen by CHS. Is that what you're saying?
No, it would still be that sick call encounter.
So then what is the unscheduled
So that's
category?
What I would say in general is it's maybe not always driven by the person in custody. It may be through these other means that it's determined that somebody needs to be brought down, but they weren't scheduled.
So a concern that's raised externally. Sure. I see. Okay, thank you. That's helpful. And so in terms of sort of the other piece of my question, which is really about what is this dashboard measuring against? I think, one of the things that we've been talking about on an ongoing basis is it used to be that these requests were done on paper. So there was something that, there was some record of somebody saying, I want to see a doctor? And is there anything that we're going to be able to use to make sure that these requests that are getting logged, I know not all the officers have been trained yet, only trained officers are able to make the entries into the database. How are we making sure that this is representative of the need at the housing area level?
Sure. So the vast majority of officers have been trained. I don't believe it's exactly 100%, but it's very close. And so from the perspective of our only trained staff entering, that I don't think is an issue at this stage. Now, our ability to then generate a report or a form that reflects these are the individuals that requested to be seen, and then what happens, that is built into this dashboard functionality.
Can you say a little bit more about how that works?
So when an officer enters the request and it goes into the dashboard, and then when that individual is brought down to the clinic officer checks that person in, so to speak, enters that they've been produced to the clinic, and that includes, we have a timestamp for that, and then once the individual is seen by medical, that is another data point that is entered into the dashboard.
Okay, so it's all dependent on recording into the dashboard.
Yes, in the same way that in a paper-based system, it would be dependent on a person writing down a disposition.
Okay, and then in terms of sort of the messaging to the folks incarcerated, it sounds like based on our staff sort of assessment and talking with individuals in custody on the ground that people were still sort of confused. I know you guys have done outreach, but it's true that this hasn't really been the main way to get to the clinic in several years. Can you talk a little bit about sort of ongoing plans to make sure that people are aware that this is a system that exists?
Sure. So I think, we have messaging on the tablets. We have posters in the housing area. There's been engagement at PIC Council. I believe we will continue to do all of those things. And to your point, as this does represent a departure from what has been done previously, it will take people a little bit of time, to get used to it.
Okay. So there's going to be ongoing outreach, it sounds like. Okay. And then my last question, I know that Health Affairs sort of tracks production. Is it possible for Health Affairs to track these sick call requests that are generated from the housing area separately from the all other requests category that it's currently lumped in with?
Oh, that we currently report it under?
Yeah.
Sure. Yeah. So one of the great things about this system is we have service categories. So the all other lists, we have greater granularity and specificity for that item now. And then, yes, we would be able to pull out sick call processing specifically.
Okay. Thank you.
Yes, Vice Chair.
Could you speak further on the service categories and what they entail?
So I would actually invite my colleagues from CHS to speak more specifically, but for example, nursing might be a category. Direct observation therapy might be a service category. A mental health appointment.
But let me ask you something. Are the service categories categorized based on medical opinion, or are they categorized based on the person in custody's request to see whoever?
So the categories of service themselves are standardized and driven by what CHS calls their various service components. When it's a sick call request, that's as deep as we go. So it's just that they're asking to be seen for sick call. So we would not have greater detail into the specific nature of the request. We would reserve that for the conversation between the person and medical.
Okay, thank you.
Sorry, one more.
Yes, Dr. Stoss.
Sorry, one more question. So I may be mistaken about this, but my understanding is that we had asked for the, in the pilot in NIC, the number of people who asked for sick call, the number of people who came for sick call, and then the number of people who were actually seen. And that for some reason we were not able to get that data. Like I don't know if that was like, this system does not produce this data yet, or we're just not ready to share this data yet, but that seemed like something that should be able to sort of come out of this dashboard, and I'm curious if we...
So can I follow up with you about that? Because yeah, I'm a little surprised to hear that, so.
Okay, and then in terms of just following up on Board Member Jude's question about reporting generally, is there a plan to produce reports as you roll this out in more facilities that would include information like that in the future?
I would certainly think so. We're happy to continue to, engage with you all and think about what that looks like.
Okay.
Okay, well, thank you. We'll now go on to department briefing on electronic logbook pilot at OBCC.
Good afternoon, Board. My name is Deputy Warden Prince. I serve as the Deputy Warden at the Otis Bantam Correctional Center, OBCC. I am here today to provide a brief update on the department's electronic logbook pilot, which was launched in mid-October, late last year, at the Special Management Unit, SMU, at OBCC and remain ongoing. This pilot represents a new and significant operational endeavor for the department and aligns with our strategic plan and modernization of the agency. With this bold and ambitious project, we are approaching, and it's deliberately focused on testing functionality and gathering staff feedback and identifying operational challenges. Overall, feedback from staff has been positive, and officers are generally able to make entries in real time. To date, approximately over 100 staff have been trained in the system, and it has been performing well. Staff has indicated that the electronic system is user-friendly, improves legibility, and allows for more efficient review across tours when compared to traditional paper logbooks. The system also allows easy retrieval of specific logbook information, which enhances oversight and supports supervisors in conducting required logbook reviews pursuant to department policy. While the department is eager to expand this pilot, we must continue to assess potential challenges, both seen and unforeseen. As you all know, our infrastructure was not originally designed to support this type of technology. Just this month, there was a temporary system outage affecting one terminal for several days. During this period, the facility maintained continuity of operations by retrieving paper logbooks and consistent with our existing procedures. Once functionality was restored, staff returned to using the electronic logbook. With that being said, the department will continue assessing the pilot at SMU, and we're currently discussing expansion at OBCC. The department is focused on ensuring that the system is functionally reliable and that necessary adjustments are made before establishing a timeline for expansion. When that decision is made, we will communicate that to the board. We look forward to continued collaboration as we modernize our agency, including the historic project. I welcome any questions that the board may have.
Well, thank you, Deputy Warden. I'd like to, before any questions come from the board, just ask, can a presentation of this pilot be given to board members? Because further questions may come. Like, I have one question, like, is the electronic logbook, can it be altered? And is it a supervisory checkpoints of altering entries, things of that nature? It could be a number of different questions. So.
Definitely, sir, to answer your question, Chair, the agency could actually arrange that with our IT board, and we could actually collectively do that and give a demonstration of the functionality of.
Thank you.
Hello, Nadia Jean-Francois, Executive Director of Intergovernmental Affairs. I just wanted to note that the department gave some staff members from the board a presentation on October 31st, and we're happy to, give another presentation if the board members wish to have one as well. But there were several members from the board staff that attended that presentation.
Okay, well, any of the board members here present?
No, it wasn't board members, it was other staff.
A board staff?
Yeah, exactly.
Board members.
Yeah, so we're happy to extend that to the board as well.
Yes, thank you. Yes, Vice Chair Skip.
So I just have two questions. I'm really curious, what is the delivery mechanism for this electronic logbook? Is this like a tablet or something? Like, how are people inputting? What are they inputting? Or do you have a whole monitor with a keyboard that they're using to input? Or is it like a tablet or something? And they want to know about the security concerns of the tablet. Like, is it permanently mounted in an area, or is it something you can pick up and carry around? Just questions like that. They might be answered when we have the briefing, so I'll be sure to attend that. My second question, because I realize the briefing might cover all of this. My second question, you talked about paper logbooks utilized during the outage. Yes. What happened to them? Were their contents, those entries, then inputted into the electronic logbook when it came back online?
So thank you for the question, ma'am. So to answer your first question, the application is launched on a desktop computer, which is encased in Lexan and some other materials that are fabricated from our FMRD division to protect the device itself from any type of tampering or any type of damage. And it's also a lock flap to secure that as well. So it's a sliding keyboard. The staff member or the supervisor will make the entry accordingly based on the services that's rendered in the housing unit. Make that entry, save it, and then secure it accordingly and respond back to the natural duties of the day. There's no tablet application or, as of yet. The agency may explore that. Again, we'll talk internally with executive staff in regards to that. And in regards to the paper logbook, yes, so we have actually captured those missing entries via the paper logbook, but the system doesn't allow you to actually put those back into it, okay? But we actually do secure that paper logbook for any type of retrieval information if necessary.
Okay, like I would say that's like an oversight, but it should be a higher level command for entry of paper logbooks into the electronic logbooks. In other words, someone of a high level should be tasked with entering that information into the system, because now you have data points in two different areas.
Of course,
which can get lost.
Of course, internally we'll discuss it more. Of course, this is a private pilot program, and these things we actually assess and see, and then we'll implement it and make those fixes accordingly.
Thank you. I look forward to attending the full, complete board briefing.
You're welcome, you, ma'am.
Yeah, and I can say that I look forward to what can be extracted from these electronic logbooks as a pilot. What type of reporting that can be presented in any particular line items of interest, any violent incidents, or just the number of recordings that are monitored on a daily basis that can be extracted and reported on.
Are you asking, or is that what would you like? I'm sorry.
I'm just being hopeful, but but the presentation.
Of course, day to day, the staff members do denote activities within the housing area, whether it be standard services such as recreation, court return, court production. Those things are entered in there to capture that. Of course, there are two terminals within the housing area, which is on the 4B post and in the A station itself, with officers are trained to utilize the terminals in order to capture these services within the application.
Well, any other questions? Dr. Stossel, Jude. I'll start with Jude first. Dr. Stossel, please.
Thank you. In the event of like a power outage or the system failing, will you resort to going back to a paper logbook?
Yes, in order to capture all activities within the housing area, yes. Yes, within the system.
Thank you. So I just want to make sure I understand sort of what this is. It sounds like this is sort of an online application that would replace, assuming there's no power outage, the same types of things that are logged in the paper logbook that, you've listed some here: housing area activities, counts, security inspections, PREA tours, maintenance tours, and touring also.
Yes, ma'am.
By officers. So I know I've been talking about touring here a lot, and I know last time we were talking about touring, there was a discussion of an electronic, sorry if I'm going to butcher this, but something that was actually on the wall of the housing area that touring officers were meant to scan. Is that completely separate from this? Does that program talk to this program?
That is a separate operation from the electronic logbook, okay? The tour wand is there, that's in place for standard touring of the house, within the housing areas between the officer and the captain, that's their assigned. That's spread out through the agency, that's already in effect. Yeah, but that is separate from the electronic logbook function.
Okay, but so touring would be something that would be entered in the logbook, but it would be entered the same way it's entered in the manual logbook, which is somebody comes and logs in, I toured at this time, and it's not necessarily a real-time verified measure.
That is standard to put that in the logbook, entries correction 101 entry, okay, for the staff member or supervisor or anybody who's visiting the post. You would definitely denote that in the logbook to document whomever entered that post. You don't necessarily need the 12-1 for that, but you just want to ensure, the staff wants to ensure that they document people who are on post.
And is part of this pilot, is there any part of this pilot that is looking at any sort of verification that the entries in the logbook, either by video or some other mechanism, are actually representative of what happened on the housing area during the time frame designated?
We haven't explored it that far. It's still in the pilot stage. Of course, there's further discussion with executive staff in regards to that, to see if those things could be, actually integrate with one another in case of an incident occurring. But we still having internal talks about that in conjunction with the pilot function.
Okay, thank you.
Yes, ma'am.
Vice Chair Skip.
Yeah, I just have one more question. So I know that you said these entries are made in real time. Yes. And am I right to assume that they cannot be edited, altered, or anything inserted in before or after? Is that what you're telling
You
me?
can't, we do make it in real time. They cannot be altered at that function right then and there. You could make a late entry, but they cannot be edited. They can't be altered.
A late entry, and that requires what, like additional language or something?
Oh, sorry, excuse me.
Yeah, that's right. General Counsel Jim Conroy. This will be very clear once we do the presentation, but there are, you would note the original entry and then the new entry and the time each was made and who authorized that. So it's an ordering function within the system. I mean, the current process, quite candidly, is we have a logbook. If we have to change it, if it's correct, you draw a line through it, and then you see the new entry. This is now a digitized version of that. So anything that we're talking about with respect to the current logbooks that are paper is now a digitized version, which with probably more guardrails in terms of auditing function, seeing who makes the entry, and then the timing of each. But again, that'll be made clear when our IT department does the pilot for you.
Yeah, I hope so, because I'm kind of concerned if entries were not made when they were supposed to, like says an officer toured but didn't tour, and then wants to go back into the electronic logbook and say they toured.
I will call that, Vice Chair, that impossible. You will see that in the pilot.
Okay.
That it can't be.
I'm open for it.
Yeah, unless someone has a technical knowledge far above what we're capable of, but even then they can't enter the system. So
All right.
I'm
you.
confident that you'll be happy with that.
Thank you. I look forward to the briefing.
Thank you.
Well, Deputy Warden, what is your name again?
Prince.
Deputy Warden Prince, thank you very much for the presentation. We certainly look forward to the board presentations of the pilot.
Thank you very much.
Thank you.
All right.
Now go to department briefing on revamp of family and attorney visits.
Good afternoon, everyone.
Good afternoon.
James Boyd, Deputy Commissioner for Strategic Operations. I do just want to acknowledge and commend our partners in advocacy for sharing their feedback. That's really insightful and helpful as we embark on this endeavor to revamp visits. I have to agree with with Tanya, my ACS alum, that this is the moment, and we are taking the moment to take action and improve the visits operation. Good afternoon, members of the board. My name is James Boyd, and I am the Deputy Commissioner for Strategic Operations at the department. I am here to provide an update on the department's efforts to revamp the family and attorney visit process. Visitation is critical to the well-being, dignity, and successful reintegration of people in the department's care, and we have been working diligently to pursue every opportunity to improve the overall visit experience. As a department's initial assessment, we saw the need to hire a dedicated leader in an executive director role to not only prioritize visits, but also lead our efforts to improve it. We anticipate the new executive director will be starting in a few days. Among many responsibilities, the executive director will serve as a primary point of contact for all visit-related matters. This individual will be tasked with leading a comprehensive review of the visit operation and continuing to develop both short-term improvements as well as long-term sustainable solutions. The executive director's work will build on foundational initiatives that we have already pursued to improve the overall visit experience, several of which I will highlight here. The department recently expanded our longstanding partnership with the Children's Museum of Manhattan to the Brooklyn Children's Museum to provide greater access to this important program. We also launched CMOM Learning Hubs at multiple facilities, offering children and their families visiting Rikers Island an interactive, child-friendly spaces during their visits. Beginning this month, our children have become a daily presence at Century Visits to provide families and children with housing resources, benefit information, and community-based services. We will also continue to pursue grant funding opportunities, support additional initiatives aimed at strengthening our family engagement work. Our partnerships only strengthen our efforts. Revamping visits is a complex but essential project for us. People in custody and their loved ones. The department has taken concrete steps to identify and address issues raised by the board, the city council, and our own staff. As of December 20th, 2025, the department resumed accepting package drop-offs in person again during visiting hours. The practice was paused following the COVID-19 pandemic, but after engaging with the board, we moved forward to resume this service. Visitors can now drop off packages in person at the reception area next door to Century Visits, and there is visible signage to help visitors locate the drop-off location. Visitors may also still continue to mail packages. An updated list of permissible items has also been posted on the department's website to provide clear guidance to the public. The department also installed new signage on Rikers Island to improve the flow of general information to our visitors once they are actually on site, a recommendation made by the City Council. The public can expect us to continue to be responsive to their needs and should be on the lookout for more updates to come. To further enhance the visit experience, the department also installed new benches in the front entrance of Century Visits for visitors who arrive early before the building opens. We thank our partners at the New York City Department of Transportation for the benches. In addition, we replaced over 1,000 lockers at Century Visits, replacing outdated, inoperable coin-based lockers. We believe this minor change will support reducing wait times. We are also partnering with Columbia University through the Town and Gown Initiative, which is a citywide university community partnership program. This collaboration is informing and supporting how we create the most efficient and effective scheduling system. We recognize that the visit process needs improvement, and we are committed to making swift, intentional, effective, and sustainable improvements. Regarding attorney visits, we recognize that technology will be the solution to improve this process, and it is a top priority for us. We hope to have updates regarding a scheduling pilot in the coming weeks. Regarding the visit working group, this is something we can look into further, and we are happy to discuss with our partners once the executive director begins. On day one, this individual who will be the executive director will have multiple tasks for them to address. And of course, engagement with partners and stakeholders is one of the priorities. We appreciate and value the support of all stakeholders as we continue to improve the visit operation for people in custody, attorneys, and the public. We know there is much more work to do, and we are working tirelessly to improve this essential service. We thank you for your time, and I'm here to answer any questions.
Vice Chair Skip.
Yeah, I just want to know, where will this person sit? Will they be based on Rikers Island?
Yes.
Where visits occur?
Yes.
Will they be in Boulevard?
Currently, we are looking for space for her in Central Visit, so she can be right on site.
Thank you so much.
Absolutely.
Board Member Jude.
Thank you. Thank you. In terms of, as an ACS advocate, in terms of CHIPS visits, how do you plan on integrating CHIPS in this new process, this new visitation improvement?
I think CHIPS, and I can let DC Cologne speak a little bit more to it. I think it's pretty self-sufficient. CHIPS occurs on non-visit days. Today is a CHIPS program, but I think once the EV starts, we'll figure out how we can fully integrate it the entire universe of visits. I think that's the overall larger plan. But we got to go step by step. I don't know now if you have anything.
Yeah, no, I just want to emphasize that the CHIP visits are operating currently. They happen on Tuesday non-visit days, and we are fully committed to continuing our partnership with ACS and continuing the CHIP visits. So while right now the CHIP visits is overseen by the Division of Programs, we assist with the clearances, we support and our partners with ACS in ensuring that that communication is happening on a facility level. We will be working in tandem with this executive director to make sure that those visits continue.
I just want to commend the department also. I know for a fact that CHIPS visits do go well, so I just want to, applaud that collaboration.
100%. I actually used to work on CHIPS visits back in the day, so I applaud the work ACS is doing on that front.
Board Member Stasso.
Thank you, DC
Yes,
Boyd,
for
and
sure.
I just want to commend you and thank you for all of the steps that you're taking to improve this process. I think it's really wonderful, bringing back the in-person packages, the updated list of permissible items, which I know is causing a lot of confusion, whatever you can do to reduce the wait times. I think, bringing back the visit sort of working group is a great idea. I just wanted to speak for a second about the attorney visit part, and I know you mentioned sort of some technological solutions. I just wanted to share briefly my experience of sort of going through the attorney visit process, which, a couple of us did in November. And I think, one thing that was concerning to me is that it seems like there is infrastructure in place to obtain relevant information about how often we're sort of straying from the 45-minute requirement from checking in at Perry to actually getting an individual in the council room with the yellow cards. And I was very concerned that it did not seem that the facilities were actually tracking the relevant information to get at that data. So at the facility level, they were very focused on the fact that they were tracking the time that the person arrived at the building, and the endpoint was the completion of the council visit. So it was a totally different metric. And then my other concern was that the infrastructure to make sure that that reporting was accurate was really missing. The timestamps the timestamp machine is there, but then when you look at the cards, they don't have timestamps. They have handwritten data in there. And, somebody said, well, the timestamp machine wasn't working. Well, now it's working, but even when it was working, people were writing that stuff in. So I just think in addition to whatever technology gets used to try to solve this problem, there needs to be accountability so that the folks on the facility level really understand, what the minimum standards are, what needs to be tracked and where it needs to go, in order to make sure that we're keeping track of sort of how we're doing with this.
Yeah, no, I appreciate the compliments. I don't want to take all the credit for us. This is a team effort, and this work of improving visits did not happen by happenstance, right? This was purely intentional and just building off the work we've been doing over the years. You're exactly right. And I think something that I said at the city council hearing is when the department started using this application called Visitor Express, which we track families throughout the visit process, I don't know why the decision wasn't made to track attorney visits in the same application. And so that Visitor Express, the board has access to it too. No problems. So this is something we're looking into, in addition to this scheduling system that we're going to hopefully want to announce in the next couple of weeks. So totally right. Here are those points. I mean, all of this work to revamp visits I would argue, is decades in the making. This is not a couple of years. This is not a pre-COVID thing. This is manifested over decades. And so this is systematic. And so we really need to dive deep to really look at it as a whole. And this is what we're doing. It's really complex, but we're doing the good work. So thank you again.
Board Member Franco, then Board Member Jude, I believe.
Yeah. And I maybe you can help us out in terms of data. And I know that you used to manage another data at the department. How are we tracking or plan to track the experience of visitors with this new approach?
Yeah, so we're also having that conversation through our research team to start thinking about how we can start an engagement with visitors to hear their experience directly. I also think that was something that spawned out of the visit working group. And so I think, I'm having conversations with Tanya directly. We'll figure out what that looks like because that feedback is critical and important, but also staff, right? I appreciate Mr. Klinger's point regarding more training, but a lot of our staff get into the business of correction because it's the closest work you have to giving back to your community. I think we say it time and again, a lot of our staff are from the same communities as people in custody, and it's essential to them to pour back into the people from their community. But also some of our staff, including myself, have family members who've been justice involved, who have been arrested either on Rikers Island or in the state, and went through the visit process. So for a lot of us, this is paying it forward, but there's no doubt that more training and thinking about what that training could look like throughout the year is an opportunity that we can certainly explore.
But I think that, which I'm sure you will be thinking about, is important. I mean, those who have done it well can actually look at the issue of visiting and incidents very clearly. I mean, it was interesting when you guys were talking about visiting. I think you may remember this experience. We learned that there were more incidents when young people didn't get visits. And there was a community group in the Bronx, Community Connections for Youth, that actually were willing to get us volunteers for those young people who didn't get that many visits, so they had someone to come and visit them. And I just mentioned that as an example.
Yeah.
Also, visiting is important, but I think what people really want is communication, which I know you talk about all the work you're doing with young people, but it would be good to know what you guys are thinking that will be the outcomes that you're going to track, that this is going better than before.
Yeah, no, I think that's spot on, is looking at the data and figure out how it correlates to the actual operations. There are numerous variables that impact the visit wait time, and it varies between, it could be the person in custody, it could be us opening late because of staffing issues. And so I think we all want to, the objective is to look into the root cause and not just the wait times on a surface level, what's kind of driving it.
I think you know this very well. It's more than wait time, it's actually the experience.
Totally.
So if you could capture that, that would be.
Sure. Thank you.
Board Member Jude. Deputy Commissioner Boyd, my thoughts were meals, or the vending, healthy meals in the vending machines, or the visit experience being past X number of hours where there's no access to food or healthy meals. With your new executive director or team or working group, if that's established, is that something that could be looked at? Because that was a big concern on 2 visits I had, that, the access to healthy foods in the vending machines were a problem.
For sure.
But if someone's there 8 hours, maybe they get a meal, that if it's feasible to supply.
Yeah, we'll be happy to look into that as well.
Okay.
Yeah.
And then you do surveys on visit experience?
Not yet, but we're going to
Okay.
have to fully responsibly, but that is something we're going to be looking into.
All right, then that is it for me, but we have Vice Chair Skip that had a question.
But this is not pertaining to sick call.
It's not pertaining to sick call, but it is for the department.
While I have you. I'm receiving reports that the PC unit at RMSC was closed. Can you confirm this?
No, which
asking.
building?
The PC, protective custody unit at RMSC was closed, and to follow that further, that the people who were housed in that unit were sent to general population.
I don't have any updates on that, but I'm happy to look into that.
Okay, can you look
Yeah,
into that
for sure.
for me? I would appreciate it. I mean, PC is situated for a reason. And if you're closing it and moving people into GP, there should be a relevant reason. And
Yeah, I just want to be fair to the department and
no,
for them
I
to
get it.
verify that, because that has not been verified.
Yeah, I would ask that you verify, either confirm or not confirm.
Happy to look into it.
My second question, again, I just have little birdies that kind of tweet in my ear at times. something about OBCC, and I believe that's you, sir, that you closed or opened more mental observation units or closed them down or something like that. Has that happened? And again, I'm just asking,
Yeah.
I'm just asking,
Are you asking if we're opening more units or have,
or closed or anything like that?
I don't know about closing any housing units in OBCC, but I'm happy to look into it.
Thank you. Thank you.
Okay. Well, thank you, Deputy Commissioner Boyd,
Thank you all.
for your time. No more questions. Thank you to the department. I'd like to also note that at our last board meeting, at the conclusion, board member Jacqueline Pitts did resign from the board. So if you don't see her presence here, she has resigned from the board. I commend her service. She served on numerous committees, dedicated to the end, and she really pushed hard for the betterment of the department and the service that this board provides. So we thank her for that. And now we'll go on to public comments. We will now hear comments from the public. Jasmine will call the names of those who signed up to speak.
Thank you. We have 3 public commenters. If there is anybody else who wants to speak, just let our staff know. And if you're online, just raise your hand virtually. The first person is Ryan Aquaoda. I'm so sorry. Aquato. And the next person is Chaplain Dr. Victoria A. Phillips. Dr. V.
Good afternoon. My name is Ryan Aquata. I work for Freedom Agenda, which is a member-led project at the Urban Justice Center. And I don't have a lot to testify to today. I just wanted to relay some things that we're hearing from people on the island to flag for the board to look into more. And so yeah, Freedom Agenda, our members are people who've been incarcerated or who have a loved one who's been incarcerated. And so we're communicating with people on the island who are currently detained. We communicate with people who work on the island, who are visiting the island. And we have also heard about from people inside that over the course of December, often without any warning, that DOC was closing or opening different MO units, shuffling people around, and that it was causing huge disruptions in medical services on the island. And it was pretty upsetting and dangerous for everyone. I heard that OBCC was on lockdown at times. People were unable to visit. And so we were just curious what's going on there. We have also heard that there are issues with staffing at CHS, that people who are often relying on medication approvals to get into ATI programs are having trouble getting basic approval of things that they need for their treatment. And I don't know if there's issues with staffing. Senior staff are not available at all the facilities to approve medications. But these are just things that we're hearing from people on the island that we would like the board to look into if possible. Thank you.
Thank you.
Thank you. Chaplain Dr. Victoria A. Phillips, followed by Natalie Fiorenzo.
Peace and blessings, everyone. You can hear me? Okay. Thank you once again. I'm Chaplain Dr. Victoria A. Phillips, or everyone calls me Dr. V. And today I just want to touch on a couple of things. Again, happy 2026. I'm super excited to see all the great work that you do this year. I have faith in y'all. I really do. I just want to highlight some things. Over the holidays, you know, I don't really celebrate American holidays. I'm indigenous. However, I respect all holidays. And over the holidays, several people had to reach out to me for lack of chaplain access, lack of religious materials and access on Rikers Island. That's a big concern of mine. As a chaplain, regardless whether I was spiritual, religious or not, if anybody on American soil, on domestic soil wants access to religious beliefs, that they should have. So I am very concerned about that because chaplains are some of the lifelines to those incarcerated. I've stood before this board before and actually had to stop when one commissioner was going to take all the chaplains out of the facilities and put them in GMDC. I say that because it was very disheartening over the Thanksgiving holiday and over the Christmas holiday to have people reach out and want me to make sure that people had access to religious people, to chaplains. Sometimes even because mental health staff wasn't getting around to them. And so they was relying on their spiritual way to help with their physical needs, their mental health needs. There should never be a time when anyone's incarcerated that they have to rely on spiritual care when they are supposed to be afforded medical and mental health care at all times. I also want to highlight that this visiting group that we talked about today really needs to come into fruition. It cannot be a hope. It cannot be a maybe. I'm not even going to be a part of it. I don't want to be a part of it. I just want to make sure that it's birthed and it's birthed right. And you've met all great people today that presented that should be a part of this group. So I encourage you all to please, you heard us, now make that happen. And make sure that the commissioner is really a part of it. Anybody else, that might be great, but we all understand things don't, especially in DOC, this paramilitary organization, things do not truly move forward in the correct way unless it comes from the direct boss holding their entire staff accountable. And I'll just say this as I end. In 2019, CHS and DOC stood before this board and said all the reasons why sick call was a flop, all the reasons why people were not being seen. In 2026, do not allow any mediocre excuse to be the reason why we allow people to die. In 2025, deaths rose by so much, 3 times than what occurred in 2024. Yes, I'm correct on that. The deaths in DOC custody rose by 3 times what it was in 2024. That's horrendous. Please, let's all work together to save a life, to save lives on the incarcerated side and on the staff side.
Thank you.
Thank you. Our next caller, our next commenter is remote, and that is Kayla Simpson, followed by Tahani Dunn. I apologize. I forgot Natalie Fiorenzo is in the building, so she is next, followed by Kayla Simpson, remote, and then Tahani Dunn.
Thank you. Good afternoon, everybody. My name is Natalie Fiorenzo. I am a senior corrections specialist at New York County Defender Services. Thank you for such a robust agenda to start off the new year today. Seeing that the clinic production dashboard has been on the agenda consistently for months, that improving access to counsel has been on the agenda consistently for months, shows me that this board is not shying away from real change. DOC's track record makes it very clear that they are not interested in improving their facilities or their care for the people in their custody on their own. It takes diligent, consistent, repeated attention and pressure to bring them into compliance with their own rules, let alone your minimum standards or city laws. And it is that compliance that will provide more humane conditions to incarcerated New Yorkers. A joint group of defenders submitted proposed new minimum standards regarding access to counsel on December 12th. These are designed to promote transparency, efficiency, and confidentiality, characteristics of meaningful access to counsel. These are minimum standards that the department should welcome, as the existing barriers to counsel drastically increases their jail population by slowing down court cases, adding several months to any individual's length of incarceration on Rikers. If the board has any questions about our proposals, please do not hesitate to reach out to the defenders. We welcome any discussion. Unfortunately, rulemaking doesn't always matter if not coupled with a culture shift. Although the Rikers Visit Working Group will focus on improving the visit process for families primarily, rather than counsel visit process, any initiative to collaborate with DOC officers on the ground, any effort to find common ground there, will certainly improve interactions and systems across the island. We are excited to see what the revamping of this group could do to address what the federal monitor refers to as a culture of dysfunction marked by violence, brutality, and neglect. I need to completely switch gears here to discuss something that is not on the agenda today, but is really incredibly concerning. In December, the Department of Correction unlawfully coordinated with ICE and transferred our client into their custody. We have not been able to communicate with that client since then. He is in a facility now out of state, not close by, and the department maintains that they have done nothing wrong. The New York City detainer law so clearly states that DOC cannot coordinate with ICE unless there is a warrant signed by a judge indicating as much. DOC's legal department has confirmed that they did not have that warrant. So why did this happen? I urge the board to keep a very close eye on the department on this issue specifically, as they are acting unlawfully and with perceived impunity. Thank you very much.
Thank you.
Thank you. The next speaker is Kayla Simpson.
Hi, can you hear me?
Should be able to present. We see you.
I see you. Can you hear me?
Can you speak? Let's see.
Hello, hello.
You're speaking. Hold on. Wait a minute. Oh, she's not muted.
I'm not muted.
Why can't we hear her? Yeah,
Testing. Hello?
Yep, we hear you loud and clear. Thank you, Kayla.
Oh,
You're good to
wonderful.
go.
Thank you so much. And sorry, I hear a little bit of feedback, but hopefully you don't hear that. My name is Kayla Simpson. I'm an attorney with the Legal Aid Society's Prisoners' Rights Project, and I'm on the team that represents the plaintiff class in Nunez. 3 things I want to touch on today, and Happy New Year. Good to see everyone. First, regarding SMU, I really appreciated the executive director's comments today. You let me cross out an entire paragraph of what I'd prepared to say. We remain extremely concerned, though, about this unit, how people are placed there, the conditions there. It has many of the characteristics of VSH and the harms that come with it. But the criteria to be placed there are even more ambiguous, and they leave a lot of room for abuse. And as the board knows, SMU involves serious restrictions, not the least of which, of course, is 7 hours out of cell, which is half that of general population. And disturbingly, the policy really offers no clear path out for people, just a determination of a DOC staff member under a vague standard. And I just want to note that this agency has a history of taking the people that it deems problems and warehousing them in restrictive settings and for extended periods. The old MDC 9 South, the West Facility, 2nd and 3rd floors of NYC, ESH. There have never been a shortage of restrictive settings in the city jails. And this is the most recent iteration. But I think we have to note that this is not the direction that the city council and frankly, the new mayor, given his recent actions, are requiring us to go. We have to reach for different responses to security problems. And of course, I think all of us will have much more to say on that in coming weeks and months. But we ask that the board continue to put SMU on the agenda, continue to report on the conditions there, and that we all continue to urge the department to work toward building the structures that are necessary for more out of cell time, more reliable staff deployment, and more effective programming for these folks. Second point regarding the electronic logbook pilot, I really appreciated hearing the update from DOC, but it raised immediate concerns about how to ensure that the information in that system is actually reliable. And I think we need look no further than DOC's truly years and years of documented failures to ensure that Tour 1 data, for example, is reliably used to see how critical those questions are. DOC mentioned in the brief update today that the system allows for oversight and supervision, but how? Is there reliable accountability if staff misuse the system or fail to log entries? And what evidence is there that accountability is actually imposed? Who's responsible for supervising the system, and how successful is that supervision? I'm really glad to hear that the board will get a demonstration of this technology, but we also ask that those questions are answered for the public too, so I would ask that you'd put it back on the agenda also. And then third and finally, Honestly, what kept striking me as I thought about what comments might be helpful today is acknowledging that we're actually at a moment in the city and for DOC that is a crossroads. Yes, we have a new mayor, and we also know from Judge Swain's orders in Nunez that she's going to appoint a remediation manager. This moment represents an opportunity. Do we double down on a status quo that has produced dysfunction and death, to oversimplify it? Or are we willing to do something different, even if it's hard? Are we willing to reach for different solutions to DOC's knee-jerk use of force, different solutions to violence, different solutions to mental health needs? Are we willing to think through correctional problems with a different lens that doesn't view people behind the walls as problems that cages can solve? And there are some necessary changes that are clear, like dysfunctional staffing deployment, more reliable accountability mechanisms, and of course some like elevating a culture that will take time. But I think this is an opportunity to break patterns, and it will require all of us from behind our computers in the room today to engage, to hold ourselves accountable, to hold others accountable. And it will require the board to reach for the same tools that the executive director began the meeting reviewing in the board's mandate: to monitor, to
Finish it up, please.
and to publicly report. And we really appreciate the opportunity today and look forward to next month's meetings.
Thank you.
Thank you. The final speaker is Tahani Dunn.
Hi, how are you? Can everybody hear me? Okay, great. My name is Tahani Dunn. I am an attorney at the Bronx Defenders as well as the director of the Prisoners' Rights Practice. I'm going to be uplifting testimony from one of our clients who would like to remain anonymous. I'm a pretrial detainee currently incarcerated at OBCC. During the months of November and December of 2025, we were subjected to emergency lock-ins or TSOs more than 10 times, each exceeding more than 12 hours and often for durations of 48 hours to 56 hours straight. During these time periods, we are denied hot water for tea and coffee or soup and oatmeal because the COs believe it is either beneath them to hand out hot water or simply refuses to assist the 48 men in their care, custody, and control. Additionally, when the food arrives, it usually sits out for extended periods of time and is served to us cold. Contrary to BOC minimum standards, the phones and tablet phones are intentionally turned off to prevent us from calling 311 or the BOC to make complaints regarding the deprivation associated with these excessive emergency lock-ins. We are denied the ability to communicate with our attorneys, families, and loved ones, and denied the ability to seek medical attention via the sick call hotline. We are denied the opportunity to shower, shave, or breathe fresh air. The anxiety we and our families experience from these emergency lock-ins is only compounded by the inability to communicate. Often our families think we are either involved in an altercation or have been hurt, assaulted, slashed, or even killed. Imminent death feels like a terrifying reality on Rikers Island when 16 to 17 people died here in 2025. During these excessive emergency lock-ins, we are also denied visitation. Our families are not informed that the facility is on lockdown and they travel sometimes long distances with children in the cold, only to be informed that they cannot visit. Many of our family members who are disproportionately black and brown sacrifice time and car fare only to be turned away and left in a state of uncertainty as to the well-being of their incarcerated loved one. Even our attorneys who may be preparing our defenses for critical court appearances are per se denied access to their clients when the facility or the housing areas are on lockdown. They may have to wait hours to see their clients. We are even denied pickup and delivery of our mail, including legal mail, which is often time sensitive. We are denied access to law library to research and file time sensitive administrative appeals and motions to court, not only pertaining to criminal proceedings, but also civil and family court matters. As pretrial detainees, we are entitled to the constitutional presumption of innocence. As pretrial detainees, we are entitled to minimum standards. Instead, we are punished as guilty, absent due process of law, and denied our minimum standards as human beings. The biopsycho and social impact of being locked into a 6x8 cage upon individuals who already suffer and struggle with mental illness, substance abuse disorder, or physical disabilities only exacerbates these pre-existing conditions, resulting in further deterioration. On December 26, 2025, I attended an inmate council meeting. Hosting this forum were two deputies. They informed the housing reps that at OBCC, Peter would pay for Paul, and in essence, the action of a few would determine whether the facility and/or the housing areas will be locked down or not. These emergency lock-ins, which affect 30+ housing units and 1,400 PICs, cause all of us to pay for the actions of a few. The problems here at Rikers are not bottom-up, but top-down. Thank you for the opportunity to testify.
Thank you. Okay, I'd like to thank you, everyone who attended and participated in today's meeting. The board's next meeting is scheduled to take place on Tuesday, February 10th, 2026, immediate following the public hearing on proposed rules, which begins at 1 p.m. At this time, I'd like to take a motion to adjourn. Is there a second? All in favor? Meeting's adjourned.